everyone to the Greener Together launch webinar. I'll just wait a couple more seconds just to see if there's anyone else joining before we make a start. Okay, perfect. I can see that there's more people joining. Okay, yeah, I'd suggest we make a start with the webinar, and then people may likely join a bit later, but I'm sure they'll be able to catch up. So yeah, welcome to today's launch webinar for the Greener Together programme at North Bristol NHS Trust and University Hospitals Bristol and Weston NHS Foundation Trust. The webinar today will be about half an hour in length. We'll be starting with an introduction to the platform by me. So I'm Siobhan. I am the program manager of the program and work for Jump, the company facilitating the program. We will then continue with a just brief talk from Samuel Willits at Bristol and Weston to talk about basically the sustainability and net zero targets at Bristol and Weston, to talk about any sort of goals that have been achieved so far and future projects. And then Megan Murphy at North Bristol Trust will be talking about a similar topic at their trust. So talk about the net zero goals and targets and any projects that have been taken so far and any future projects. After that, we'll be going through a couple of poll questions that we've prepared for you. We'll have a quick Q&A session to answer any questions that you may have about any internal projects that are running at either trust, but also about the program. This video and webinar will be recorded, so if you have missed anything or want to rewatch the webinar, then you'll be able to do so. Perfect. So yeah, I'll start my presentation on here we go. Brilliant. So yeah, I've taken you through the agenda briefly, but basically what the aim is of the program, just to get started with, is that we encourage you to sign up, and then the program will allow you to take part in various different activities all around sustainability, and you will be able to win prizes the more activities you take part in and the more green points you earn. This can be individual rewards, but also we have team rewards for you. The overall aim is that we encourage everyone to take part, and individual action by several staff at both trusts will cumulatively lead to a high impact. All the activities that are included in the program are easy activities, or meant to be very easy activities that everyone can really integrate into their everyday life to ensure that sustainability and taking sustainable action is something that everyone can take part in. So here are a few of the activities that are on the program. There are a different set of activities for people or staff at Bristol and Weston, and another set of activities at North Bristol Trust, just to fit the different projects that are run and the different interests at either trust. But yeah, there are a few different ones on here that you can see. For instance, we're encouraging more sustainable diets, meat-free days, adding green spaces into either your garden, your office, anywhere really. More active and sustainable travel. So you'll have a low carbon commute here and cycle to work. We're promoting sort of more efficient use of energy, and also swapping single-use items for more sustainable items. So yeah, there's a bit of an example selection here. There are, as I mentioned, different rewards that you can win if, as an individual user, for instance, you take part in loads of different actions and activities and therefore gain more green points. So at each trust, we have a selection of voucher options that you can choose from on a monthly basis. These will be £20 in value. And yeah, here you can see the selection of vouchers that you can choose from. So we have the National Garden gift voucher, Wild Oats, Zero Green, Good and Proper, the Ethical Superstore, and the Trestle Trust donation. So we contact the winner each month with a selection that they can then choose from. But yeah. There's obviously also for the highest point scoring team, we want to give them rewards too, obviously. And here we have a prize every 6 months, or a reward every 6 months for the top performing team at each trust, where they can give £600 as a donation to a sustainability project of their choice at each of the trusts. Again, this will be based on the highest number of green points, but this will then be the average green points based on the number of staff members within that team, just to make it fair for varying numbers of members within teams. So to sign up, you can follow this link here, and then you can sign up either on the platform, or you can head to the App Store or Google Play Store to download the app. Perfect. Yeah, so that was a quick introduction into the program. So yeah, we invite some Willets to speak about sustainability at Bristol and Weston.
Thanks, Siobhan. I was almost just signing up there. So I hope everybody is, whilst they're doing this, you can listen to me and sign up at the same time. So over the past couple of years, the NHS has gone through an extraordinary time, and we've had to reconfigure our health services to meet the needs of our communities during the pandemic. And that pandemic has really exposed and exacerbated health inequalities, which have a disproportionate effect on our disadvantaged communities. However, whilst that demand on our service has been extraordinary, the NHS has adapted flexibly, collaboratively, and at pace. And the key point here is that climate change will have a similar effect and disrupt our communities. And I really hope we are able to respond in a similar way. Climate change is the single largest threat to global health, affecting our social and environmental determinants of health, such as clean air, drinking water, food, and shelter, real basics. And those climate change impacts will increase illness and mortality from extreme weather events. They contribute to cardiac and respiratory illnesses. They increase the spread of water and vector-borne diseases, and they significantly impact on our mental health. The latest report from the Intergovernmental Panel on Climate Change is really scary. It tells us that the window of opportunity to avoid climate breakdown is rapidly closing, and that we've got to make sure greenhouse gas emissions peak by 2025, so they don't go up after that and start dropping rapidly. And our government has put in place plans to decarbonise with a net zero target of 2050. The policies put in place for that are having a direct financial impact on the trust. There's increased taxation on our greenhouse gas emissions and on waste, along with the soaring energy prices. These really strengthen the case for us to improve our energy efficiency and make those reductions. In 2020, the NHS became the world's first health service to commit to reaching net zero by 2040. and or 2045 if we look at all our emissions, including our supply chain. At UHBW, we took a step further, that in line with the One City plan, we declared a climate emergency and set a target of 2030 for becoming carbon neutral across all of our activities. And I'm really pleased to say that's expanding across our new care system. We want to be one of the most sustainable health providers in the country, and we have made good progress, but there's still a long way to go, and we really need everybody in the trust to be on board. Over the last 18 months, the sustainability team has been working on various heat decarbonisation projects across our sites. We were lucky to get £18 million worth of funding, and this has enabled us to install over 5,500 LED light fittings and the first air source heat pumps in our trust, which is something we're going to have to see much more widely across the whole of our country. We've upgraded our combined heat and power system, which means we've got 80% reduction in our grid electricity that we've brought in and improved our energy security. We've also put in 489 solar panels at Western General Hospital, which has increased our renewable energy generation. We've been actively promoting sustainable travel and improving cycling facilities, increasing the capacity and security. We've introduced personal travel planning for staff, which will help support the introduction of Bristol Clean Air Zone and encourage active travel. The shuttle bus service is going to be increased to support public transport options and other ways of staff commuting. We've got 7 electric fleet vehicles, and we're continuing to push our clean vehicles. We've also got 8 electric bikes, which staff can try out before they decide to buy them under the salary sacrifice scheme. You might have seen me on the telly last week. We're starting a trial of 3 e-cargo bikes, which are going to be for moving IT and medical equipment around our site. So the progress we've made at the Trust to become a sustainable health provider can't be done just by the sustainability team. It really involves others across the Trust. We've been working with clinical colleagues on anaesthetic gases, which have a big greenhouse gas impact. In fact, they make up about 2% of the NHS's emissions, and we've made some significant reductions there, and there's still plans to move further with that. We've also worked on a sustainable procurement strategy, and procurement makes up the biggest chunk of our carbon emissions, so it's really important. We've been working on that jointly with North Bristol and our purchasing consortium, which will make sure we are considering sustainability impacts in our decisions about any procurement going forward. Our sustainable waste management team have set up an initiative with the University of West of England to give them out-of-date clinical items which would have been thrown away, but they can now use for training new nurses. So it's a really useful use of those resources rather than being thrown away. We're also part of a pro-innovation procurement project, again, jointly with North Bristol Trust. It's where we're engaging with the market to see how we can achieve zero waste and reduce single-use plastics, with the incentive to the market that if they come up with the right solution, we will buy it. So we're really trying to push our supply chains to develop more sustainable goods and services to meet what we require. We've introduced recycling for disposable takeaway cups, bread bags, and crisp packets. And we've got a new reuse program called Warp It, which I know they've had at North Bristol. Ours hasn't been around for long, but it's already paid for itself, which is very exciting. The system covers reusing furniture and office consumables, but we've got plans to expand that wider to electrical and lab equipment and other things, and also how we can share reusing things more widely across our system. Due to the pandemic and associated pressures, it's been challenging to engage colleagues in sustainability over the past year. Although I'm amazed at how much their interest there is out there and the growing awareness of climate change and the impacts if we don't address it. As health professionals, we will see the direct impact and the ever increasing pressure that climate change will have on our service. It's our duty to improve health, not negatively impact upon it. We've got to recognise the impact our actions have. And as the largest employer in Britain, the NHS is responsible for 3% of the nation's carbon emissions. We've got to change the way we work and contribute positively to planetary health. So we absolutely need your help. Every colleague has a part to play in helping the Trust become the most sustainable healthcare provider in the country. And it's fantastic. We already have 44 sustainable healthcare advocates at the Trust working across all our divisions. And they're helping the sustainability team to raise awareness and promote positive change. And so today, I'm really excited that we are launching our new staff engagement program, Greener Together, along with North Bristol Trust, and looking forward to that spreading more widely across our integrated care system. We hope you'll find this new program engaging, informative, and empowering, and it'll enable you to make changes at work and at home, allowing you to take informed action and encouraging you to engage with your colleagues, friends, and family. So thank you for your support.
Brilliant. Thank you, Sam. Yeah, it's incredible. You have very, very interesting projects happening, and it's very, very clear that you have made a lot of sort of decisions and moves towards your targets. I think the point that you mentioned about it's not just the sustainability team's sort of responsibility to care or take sustainable initiatives, but it's several departments and really everyone's responsibility. And I think that reflects back really well to the program, with as many people as possible taking part to have that impact. So yeah, that was really brilliant. Thank you so much. Then Megan, I invite you to speak next.
Thank you, Siobhan, and thanks everyone for joining the webinar. I hope you've all signed up while Sam has been speaking, or you can use this time now to sign up. We're really excited to launch this Greener Together engagement app. As Sam said, during the pandemic, we haven't been able to engage as much with our staff as much as we'd like to. So we're really hoping that that'll kind of like kickstart that engagement again with our staff members. But yeah, just to talk a bit about NBT, North Bristol NHS Trust. So yeah, we deeply care about our impact on the environment and our contributions to climate change, which is the reason we have our net zero goal. We also care about the influence that we have over creating a fairer, healthier and more equal world. Is why in our NBT Trust strategy that you'll see we have a commitment and a promise to develop in a sustainable way. So that's kind of one of our key strategic focuses, which is embedded throughout the Trust, not just like the sustainability team. But we also want to be like mindful of how our activities impact the environment and also the well-being of our staff, patients and the local community. So in October 2019, alongside university hospitals, Bristol and Western, we declared a climate emergency with the goal of becoming net zero by 2030. So the net zero goal is a really highly ambitious goal. It goes one step ahead of the UK government's and the wider NHS goal. But we recognise that this goal will really drive the urgent action that we really need to start making, and we need to act though we are in a climate emergency essentially. So that means that we need everybody in the organisation, every single role, every department will really make a difference and drive us towards this goal. Everyone's contribution will really, really matter. And as an anchor in the community as well. So the goal to net zero by 2030 is a public acknowledgement of the threat that climate change has on our health. So there's an inextricable link between climate change impacts and human health. And it shows a clear and positive commitment to tackle climate change, this goal, and the effects that this will have and will continue to have on the health of our population. So to be a holistic and forward-thinking National Health Service Trust, we must look to the future and mitigate the coming pressures that are associated with climate change. And we must do everything as we can as a trust, as we have that kind of duty to our communities and the patients that we serve, to minimise our contribution to the increasing rates of climate change-related diseases. So North Bristol NHS Trust is made up of approximately 10,000 staff members, who have actions that create greenhouse gases, which add up to complete our overall carbon footprint. So this is through the vehicles that we drive to work, the way that we reach our patients, kind of the instruments that we use in our day-to-day jobs. So to reach net zero, we really need to reduce our carbon footprint by 90% based on our 2019 baseline. So if we work together, we can really make sure that this happens. So not just the sustainability team, but the whole of the trust, which we've already seen happen throughout the trust throughout the years. So MBT's Sustainable Development Unit, Carbon and Energy Manager, and lots of other brilliant people from all across MBT have already been working really hard to make progress to help us achieve our goal. So just to go through things that we've recently done. So we've created new green spaces across the trust. So one recent example was the creation of the ICU roof terrace. So this includes some brilliant consultants in the ICU team and our nature recovery ranger. So yeah, this is a really nice roof terrace with new planters on it that staff and patients can enjoy. We've also fixed our existing PV panels to make sure that we're creating as much renewable energy as possible and we're not as reliant on the grid. We've also obtained a few grants as well recently to install LED lighting across our trust, to install air source heat pumps as well, and to improve the insulation of our buildings, so they be as energy efficient as possible. In terms of sustainable travel, which is huge at our trust, we have a very significant amount of staff that already do travel sustainable to work. So we've continued to run our loan bike scheme that encourages staff to travel sustainably. So we have e-bikes as well in them options. And there's a lot more to come as well in the pipeline, particularly around our buildings and energy sector. We've got a lot of exciting projects, and anaesthetic gases as well. We've got a trial going on at the minute to try and capture these from the theatre environment. So there's groups of staff from all divisions and directorates across MBT that are conducting their own projects. So they've taken the initiative to kind of develop a project related to sustainability to get us to net zero, with the help of the Sustainable Development Unit. So just a few examples of these: the Employment Services team going paper free. We have the pharmacy team who are currently investigating lower carbon inhalers and how we can prescribe these to our patients. There's also theatres that are helping the charity to investigate the supply of reusable cloth hats to all theatre staff. We've got the trauma and orthopaedics team who are moving unused items from the carpal tunnel surgery kit that they don't previously use, so kind of reducing their consumption of those items and changing their procurement behaviours. And there's so many more people around the trust that are already changing their commutes to walk, run or cycle. To give us direction in our net zero by 2030 goal, we, alongside an external consultancy, have developed a carbon route map. So this charts a path to decarbonise all of our trust services and activities by 2030. So it tells us step by step exactly what we need to do and when to be able to accomplish this. So each of these steps require the help of MBT staff from all across the organisation. It particularly identifies that behaviour change will be really key to unlocking a lot of these barriers to get to net zero. And a great way to get involved in our net zero journey is through joining the Greener Together app. So we look forward to seeing many of your names filling up the leaderboard by using resources fairly, working within our environmental limits and adapting away from our carbon intensive practices. We hope that we can protect the natural ecosystem, reduce pressure on our NHS and achieve our net zero goal here at MBT. As an organisation, North Bristol NHS Trust is proud of its commitment to aim to be net zero by 2030. And there's not many organisations that have committed to this really kind of ambitious goal, but we hope that it will drive the urgent action that we hope to see. And yeah, we can all do more to leave our community a healthier, happier and greener place to be.
Brilliant, thank you, Megan. Yeah, again, it's really lovely to see sort of what the projects that you're running at NBT, and again to see sort of how the different teams across the trust are getting involved. Something as well that I found really interesting is the new green spaces that you mentioned on the ICU roof terrace, and ties in really well with the activity that I showed earlier on one of the slides about increasing green spaces. So yeah, a lot of things that are very relevant and tie in very well with the program. But yeah, brilliant. Thank you so much. Next up, we have a couple of poll questions for you. So I will start with the first poll, and then you can vote for the answer that you think is correct, and then we'll see if you're right. Perfect. So publish this first poll now. It says here, which makes up the largest of our carbon footprint? Is it building, energy use, supply chain, patient travel, or anesthetic gases? I'll just wait for a couple of more seconds to give everyone a chance to respond. I can just see a lot of more answers coming through, so I'm going to wait for a bit longer. Perfect. Yeah, the majority is correct. So it is supply chain. Yeah, 60% have answered correctly. Good guess, or good knowledge. Brilliant. I'll move on to the second poll question. So this is asking, what year are Bristol and Weston and North Bristol aiming to reach carbon neutral? This has come up in both talks just now, so testing how well you've listened. Brilliant. Yeah, the majority again is correct. So it's 2030, 87% responding correctly. Perfect. Thank you. And then up to our last question. So this is, of the UK's total carbon emissions, what percentage is produced by the NHS? See a lot of people still responding, so I'm going to wait for a bit longer. Perfect. Yeah. Again, majority correct. So it is 3%. Thank you so much for responding. So that's, yeah, 40% have answered correctly. So as mentioned earlier, we are having a quick just Q&A session just to answer any questions that you may have, either about the program or internal projects that are run at either trusts. So if you're happy to add any questions into the chat box, and then we'll read them out, and then, yeah, give an answer accordingly. Okay, I'm just going to wait for a couple of more seconds to see if anyone has any questions. So you can always get in contact if anything comes up question-wise after the webinar as well, if you don't have any immediate questions now. Okay, thank you, Suzanne, for joining. Okay, there is a Q&A question. When will low temperature heating be introduced?
It's we're working on a plan. I've actually got to read a report this afternoon, which will help us with that. But the target is 2030. So that's when we've got to get it done by. A lot of the work to be able to achieve low carbon or lower temperature heating, low carbon, is going to be quite invasive. So it probably will need to be an 8-year program. So I'd say it will be done by 2030.
Yeah, same for us here. So we have recently had a grant to complete heat decarbonisation plans for each of our buildings, and that has told us which buildings are suitable for heat pumps and which type of heat pump, and how much is that going to cost, and when exactly do we need to start installing them heat pumps to be able to get to 2030 when we want to. So we have got a really clear plan in place. We're in the middle of just digesting those reports at the minute that we've got from the consultant, and then we're hoping to kind of like drive action. There's already business cases that are being written out.
Thank you. Yeah, we do have one more question here. Are Bristol and Weston increasing the number of motorcycle spaces? There seems to be talk of additional cycles only.
I don't know the answer to that one, but the focus is very much on bicycles spaces. That's where we've got the biggest demand, which you can tell by walking around our site and seeing the number of bicycles chained up to railings all around our site. So that is our focus at the moment.
Thank you, Sam. Okay, I can't see any questions coming through at the moment. But yeah, as I said, if there are any further questions, then feel free to get in contact, and then happy to answer anything after the webinar. I do have there is one more. What role can the trust play in making cycling safer off trust property?
Yeah, well, we are working with the council to see how we can improve all sorts of transport across off-site, and in preparation for the clean air zone. And part of that is looking at off-site cycling. But it's more, I suppose, it's using our influence. We've got 13,000 staff. A significant number of them cycle, so I think it's acting as a voice for those people to try and encourage things. But yeah, it's a tricky area.
Thank you. Considering time, I suggest we end the Q&A here. But yeah, as I mentioned, get in touch, please, if there is anything else you want to know. Before we end the webinar, I do have a question for both Sam and Megan. So if there is any one action that you would take or would encourage people to take to further sustainability, potentially connected to the program as well, then what would it be and why? The floor is yours.
I'm happy to go first. So yeah, I think it's already been mentioned in the chat, but I think traveling to work, the way that people travel to work is really important, probably more than we actually realise. So we recently had like a carbon route map drawn up for our trust, and it states that travel and transport contributes 21% to our overall carbon footprint, and 58% of that is related to how staff and patients actually get to our site. So not everybody can obviously travel by sustainable or active means. So I think it's really important to have conversations with your colleagues and kind of enter it into like any team huddles that you have, and see how people get to work, if there's potential for like car sharing, kind of getting the bus, any kind of option that you can. I think just figuring out how you can travel to work more sustainably, maybe just once a month would even make a difference, or just having them conversations with your colleagues to see who actually can, and any barriers that are in the way for people as well, trying to kind of unlock them.
Thank you. Sam?
Yeah, well, I wasn't sure how to answer this one, but your first screen showed me, because my competitive urge came out, and it was 250 points for cycling to work. So I want everyone to get their 250 points, because that was the maximum, biggest one you could get, and that's how we can maybe beat NBT. So on the competitive front, that's the one to go for.
Perfect. That's great to hear. Yeah, I'm very glad that the competition element is being brought to the forefront here. Yeah, brilliant. Thank you so much for both brilliant answers. And yeah, we'll end the webinar here. As I mentioned at the beginning, we will send around this will be recorded, so you will be able to watch and have access to the webinar following this live stream. But yeah, I just want to thank you everyone for joining the webinar and attending the webinar. Thank you so much. And yeah, thank you to Megan and Sam for speaking today. Both very, very interesting talks. So thank you so much. And yeah, I wish you all a lovely day.
Thank you, everyone.
Thank you.